Hello everyone, this is Team 5. We decided to research leukemia and the effects that tretinoin can have on it. My group members' names are Samantha Porter, Mia Hogan, Connor Morrison, and my name is Katie Davis.
In the human body, there are three different types of cells in the blood. One of these three are white blood cells. White blood cells are an important component of the body's immune system. Leukemia is defined as a disease in which increased numbers of immature or irregular white blood cells are present in the blood and bone marrow. Researchers believe that leukemia occurs due to mutations within the DNA of blood cells that leads to the overproduction of divergent cells that both congest bone marrow and overwhelm healthy normal cells. Two major subtypes of leukemia are acute and chronic. Acute leukemia is an aggressive, rapidly developing form of the cancer that can progress to fatality very quickly. Chronic leukemia is slower growing than the acute form, but it is thought to be more challenging to treat, and oftentimes the goal is to manage symptoms. In acute myeloid leukemia, some of the genetic mutations allow for apoptotic resistance and increased proliferation, which aids in the survival of leukemia-affected cells.
Hello everyone, my name is Katie Davis, and I will be talking about the epidemiology of leukemia. Leukemia is a fairly common disease in the United States. It is ranked as number 10 on the list of most common cancers. Leukemia represents about 3.2% of new cancer cases every year within the country. According to data that was collected from 2016 and 2018, it is said that 1.6% of American men and women will be diagnosed with leukemia at some point in their lives. This year alone, it is estimated that about 61,000 people will be diagnosed with leukemia, and 23,660 people will die from this disease this year. And just to put this into perspective for you guys, the amount of people that will die this year from leukemia is about the seating capacity of Madison Square Garden. Leukemia is also amongst the most common cancers that are diagnosed in children. There are about 3,500 kids diagnosed with leukemia in the United States every year. However, it is seen most in older adults. The 5-year relative survival for leukemia is currently 65%. The median age at diagnosis is 67, and the median age at death is 75. Men usually get leukemia at higher rates than women. Every year amongst men, there is 18.3 new cases per 100,000, and amongst women, there is 11.1 new cases per 100,000. This disease is most prevalent amongst white and non-Hispanic individuals. Even though more men are diagnosed with the disease, the death rate per 100,000 is about 6.3 for both males and females. The trends on the graph over time show that leukemia cases and mortality are fairly stable. One may argue that the new cases have slightly begun to rise and that the mortality rates have slightly fallen. However, the numbers have not moved enough over the past 40 years to show a significant change. The Cancer Statistics Center reported that the highest cases of leukemia occur in Arizona, California, Florida, Illinois, North Carolina, Pennsylvania, and Texas. These states are also amongst the states that have the most cigarette use. According to the CDC, 14 out of 100 American adults smoke cigarettes. Out of those who smoke those cigarettes, typically smoke about, on average, 14 cigarettes per day. Cigarette smoking remains as the leading cause of preventable disease deaths. Every year in the United States, about 480,000 people die from the diseases that occur as a result of smoking cigarettes. This is about 1 in 5 deaths that occur in the U.S. I found this number to be very high, especially with how much research we have on what tobacco can do to one's body. The scholarly article I chose to speak about in this presentation is called "The Relation Between Cigarette Smoking and Risk of Acute Myeloid Leukemia, an updated meta-analysis of epidemiological studies." This was conducted by 4 different researchers in 2014 that I will be referring to as Berkansis et al. Later in the presentation, the different types of leukemia will be discussed. The objective of this study in particular was to see the relationship between smoking tobacco and developing acute myeloid leukemia, otherwise known as AML. Like I previously mentioned, it has already been revealed that smoking tobacco is a risk factor for many diseases. So that is why Furcanis et al. Felt this study was worth looking into to see if it had any correlation with AML. This study studied the data amongst 20 observational studies between the years of 1993 and 2013. It was found that the factors that affect the relative risk of getting AML from smoking cigarettes are the intensity of smoking, the duration of smoking, and cumulative smoking. Berkanis and the other researchers concluded that current smokers have a 40% increased risk of developing AML, and past smokers have a 25% increased risk of developing AML. As it says in the snippet that I have uploaded from the article, the increased relative risk of AML was increased by smoking cigarettes regardless of sex or geographical region. However, the study failed to consider race as a factor when conducting the research. It is important to continue this research with this in mind. It is also important to continue educating people on the risks that come along with smoking cigarettes. The number of smokers has dropped over the last couple of decades, but we still have a long way to go because of new smoking mechanisms like vapes.
In clinical research, there are 4 different subtypes of leukemia, and they are categorized by the type of progression, whether they are acute or chronic, and the type of white blood cell type that it affects, whether it's lymphatic or lymphocytic or myelogenous. So the 4 different types, there's acute lymphocytic leukemia, or ALL, which is most common in young children and rarely found in adults. There's acute myelogenous leukemia, or AML, which is the most common in children and adults, frequently found in both. And it's the most common acute form that is found in adults. And then there's chronic lymphocytic leukemia, or CLL, which is the most frequent chronic form found in adults. And there's chronic myelogenous leukemia, or CML, which is mainly found in adults and rarely found in children. Now, CLL you can have for years without needing treatment. And CML, you can have little to no symptoms until the cancer enters a fast-growing phase, and that was whenever most people find it and would then seek treatment for it. And the prognosis relatively for all forms of leukemia is 65% over 5 years for survival rate, and that was taken from data from 2011 to 2017. And this prognosis is highly influenced by the patient's health, what age they're diagnosed, and what type of leukemia they end up being diagnosed with. Acute leukemia has a high propensity to spread. It is in the blood, it can spread throughout the body, and is likely to metastasize. The treatment protocol varies a lot, so it varies depending on the severity and the type of leukemia the patient has. And the type of treatment varies a lot, including common forms are chemo, targeted and radiation therapies, a bone marrow transplant, and immunotherapy as well. So for our targeted therapy, Tretinoin, the patient experience is relatively decent and very common to high doses of vitamin A. So Tretinoin is currently in phase 1 and phase 2 clinical trials with different types of treatment in combination with that.
but it has also already been FDA approved for a type of AML, which is known as acute promyelocytic leukemia, or APML. So like I said, the side effects that are common, more than 30% of patients see them, are similar to those taking high doses of vitamin A. And those include headaches, fever, nausea, chills, general symptoms like that. Some of the less common and more severe side effects that some patients see, and those patients, approximately 10 to 29% of patients see them, would be weight change, whether it's unexpected loss or gain of weight, insomnia, depression, and sometimes numbness in the hands and feet as well. Tretinoin research does show when treating APML that it does induce complete remission in patients. As far as resistance, so tretinoin is going to be used whenever the patient has already had chemotherapy and they are showing resistance to that chemotherapy. And resistance is common in leukemia, mostly in acute cases, because it is fastly replicating and adapting to different drug therapies.
Tretinoin isn't only a cancer treatment. The therapeutic uses of this treatment extend to topical gels used to treat acne of all things. It is also used to reduce the side effects of light exposure, i.e. discoloration, dryness of the skin, and wrinkling. The drug is used topically to combat a variety of skin conditions, from skin cancer all the way to psoriasis and, of course, acne. However, in its use combating leukemia, tretinoin is typically reserved for patients undergoing remission. During treatment, 40% of individuals saw an increase in white blood cell count. And tretinoin is proven to be more effective when administered in a combination therapy. Tretinoin is used explicitly for inducing remission. For gastric cancer specifically, tretinoin has increased the remission rate drastically, from 15% all the way up to 85%. 1/4 of tretinoin recipients develop a condition known as retinoic acid APL syndrome. The condition carries with it many severe side effects, including organ failure. Pregnant women should avoid taking tretinoin, as this increases the risk of birthing a deformed baby. This is supported by the fact that 2 other vitamin A treatments are teratogenic, which means it's a compound that is ingested by a woman that ultimately affects the fetus. And these compounds activate retinoic acid receptors, limiting proliferation and shortening telomeres through the inhibition of telomerase. With the potential downsides of a tretinoin treatment being so detrimental, the use of this treatment is reserved for those individuals who have been failed by prior chemotherapies. There is a management therapy available to reduce the risk of adverse side effects when taking this treatment. It is theorized that tretinoin is broken down via its own metabolic pathway, thereby inducing its own metabolism. And then lastly, here is our citations. They're pretty small, but there they are.